Hello everyone, welcome back to my channel. I'm pharmacist Awele, and in today's video we'll be talking about a very important topic every woman should understand: ovulation. So you see, knowing how ovulation works is not only key to fertility or conception. You also need to know ovulation in order to know how your body works, how to manage your health, and also plan and prevent pregnancy naturally. So I encourage you to stick with me to the end of this video, because you will not only know the basis of ovulation, but also recognize the signs that your body will, signal to you and tell you, oh, you are ovulating. Now, in this video, we'll be talking about what is ovulation, what are the signs and symptoms of ovulation, when does ovulation happen, then how to track your ovulation, and why does it matter. Okay, let's get into it. Let's start with the basics. Ovulation is the phase in a woman's cycle, a menstrual cycle, when the eggs, that's the matured one, is being released from the ovary. So let's take, for instance, the ovary could represent a storage house for the egg. So when this egg grow, they get matured, and then they are being released. Now, this is a simple way of your body telling you, oh, it's time for possible pregnancy. Once it gets released, it travels down through the fallopian tube and happily waits for a sperm to get fertilized, and possibly leads to pregnancy. But if there's no sperm, then the egg, sheds or breaks down, and about 2 weeks later, your period arrives. Typically, ovulation occurs around day 14 in a 28-day cycle. It's not the same for every woman. Some persons experience different menstrual cycles, some from 21 days to 26 days to 35 days. So if you have a menstrual cycle of 30 days, that means you'll be ovulating around day 16. If you are 26 days, that means you'll be ovulating close to day 12. That's why it's very, very important to track your ovulation. There method you can use in tracking your ovulation, from different and various apps. To you can use your calendar. You can also use an ovulation predictor kit. The truth is that your body does not know how to keep secrets. It will send you signal whatever is happening in your body, whether good or bad. So that means it's very important for you to pay attention to your body and understand your body. Now, number one sign of ovulation is the cervical mucus discharge. Now, this discharge is usually clear, sticky and slimy or slippery, just like the egg white. Another sign is the basal body temperature rise. This usually occurs after ovulation. It has a pattern, so it's very important for you to track your temperature, first day of your period, and when it goes like 2 weeks, about 2 weeks later, you see that there will be a slight increase in your temperature. Once it starts rising, you have ovulated. So that's another sign of ovulation. Then thirdly is a mild pain and things. Well, not all women experience this pain. Some women experience a sharp pain just at the lower abdomen, and it's usually called the middle pain. And another interesting sign is increased sex drive. Just naturally, during ovulation, you find out that you have this desire to have sex. It's not wrong, it's not bad, it's a natural way of your body telling you, hey, you are going to ovulate. Then there are other signs, just like breast tenderness, your breast becomes heavy a little bit and, tender to touch. Then there's bloating and also an increased sense of smell. Understanding ovulation is a big deal. For instance, for couples that are trying to get pregnant, it's very easy for them to, maximize their chance of conceiving. And when to try, you can try 5 days to your ovulation and the ovulation day itself. If you're not trying to conceive or to get pregnant, tracking your ovulation will know when you are safe or when you are not safe. So it's very easy for you to, plan and prevent pregnancy. So another reason to understand ovulation is for overall health. For instance, if you find out that you're not ovulating, it's either there is a medical problem or there's a medical condition that is affecting your ovulation, such as polycystic ovary syndrome, then also thyroid problem, or it could be hormonal or any medical condition. So when you notice that you're not ovulating, you have to go to the hospital to check it out, to be on the safer side. Then lastly is tracking. How do you track ovulation? There are different and several methods of tracking your ovulation. Number one is you use the calendar. When you track for a few months, you'll be able to know your fertile window period. You'll be able to know when you ovulate or not, because there's going to be a pattern. Body temperature rise. This usually occur after ovulation. So you just look out for a pattern, a rise in temperature after ovulation. The next is the ovulation predictor kit. It works just like pregnancy test. It detects luteinizing hormone surge that happens before ovulation. And lastly is the app and the digital tracker. Now, there are various apps out there that can help to predict when you're ovulating. The one I usually love is the Flow app. Well, this is not a paid advert, but the Flow app is very easy for you to navigate. The prediction is almost like 80%, right? Or 90%. That's good, right? So it helps to predict you. It helps to predict your ovulation and also when you'll be menstruating. So they are also very easy to use app out there too. So these are the methods you use in tracking your ovulation. Okay, so tell me in the comment section if you track your ovulation. Now, what method do you use in tracking your ovulation? I would love to hear your experience. If you find this video very helpful, kindly give this video a thumbs up and comment. Then you can also share to someone that needs it out there. I'll see you guys in my next video. Bye.